晨啊，咁多位大家早晨嚇。咁我咧係更新會嘅職員啦，紅姑娘 Emily 嚇。大家早上好，我是更新會的職員，我姓洪，我叫 Emily 嚇。歡迎大家呢來到今天我們的前列腺癌的支持小組，歡迎大家嚟到今日嘅前列腺癌咧支持小組。我哋今日咧係有兩個部分嘅，第一個部分咧係講座啦。咁今日你上嘅呢個 YouTube 平台咧就係講座嚟嘅嚇。咁大概去到12點之前，我哋完結之後咧，我哋喺12點3度開始咧，我哋係會有一個交流會、分享交流會，係用 Zoom 嘅平台嚇。咁如果有啲朋友係登記咗嘅話咧嚇，你係應該已經收到嗰個連結或者點樣登錄 Zoom 嗰個方法㗎啦嚇。咁如果你話你都聽完呢個講座有興趣，同其他前列腺癌嘅病人嚇一齊講下呢個 topic 呢個題目，又或者分享一下你嘅治療嘅一啲種問題，或者係種嘅一啲嘅感受等等咧，亦都歡迎你咧係嚟到參與。咁如果你想攞到呢個 Zoom 嘅連接嘅話咧，歡迎你打咧係0292127789，我再重複一次嚇，0292127789咧嚇，或者喺你熒光幕下邊有顯示啦嚇，有一個嘅手機電話同埋我哋嘅辦公室嘅電話，你都可以打嚟咧，我哋會將嗰個連接 Zoom 嘅連接咧俾你嘅嚇。就是我們今天的這個支持小組前列腺癌的支持小組呢，分開2個部分。第一個部分呢，是從現在到大概12點鐘呢，是我們講座的部分哈。然後呢，12點1刻左右到1點呢，我們是有一個交流分享會，會針對今天的題目，或者是平常你的治療的一些的情況，跟我們其他前列腺癌的病人呢，是有一個分享的時間哈。那個呢，我們是通過線上的 Zoom 會議哈。如果已經登記的朋友呢，你應該已經收到哈，我給你們發的那個 Zoom 的怎麼樣上去的那個方式方法哈。但是如果你現在決定你想參加，或者聽完講座你決定想參加的話呢，請隨時按照屏幕下面的那個電話號碼給我們打電話哈，我們會把有關的鏈接呢給你發過去，那變成我們有個機會能夠跟其他前列腺癌的朋友呢交流哈。我跟大家解釋一下呢，今天呢我們的講座，當然在我旁邊的大家已經看到他是會講英文的一位洋人的嘉賓哈。他講完英文之後呢，我們的翻譯為了避免大家又聽廣東話又聽普通話，時間太長了哈，所以我們的翻譯員呢是會給大家翻譯成普通話的哈。咁講今日嘅講座嘅形式咧嚇，喺我身邊嘅係一位我哋嘅嘉賓啦，咁佢係西人，所以佢講嘅係英文啦。咁除咗英文之外咧嚇，咁我哋亦都會將佢咧係直接翻譯成普通話嘅嚇。咁希望咧大家咧會係能夠喺屏幕側邊咧係安坐喺度咧嚇，聽我哋嘅普通話嘅翻譯啦嚇。咁然後咧咁頭先亦都講過啦嚇，歡迎大家咧係參加我哋之後嘅小組嚇。咁喺呢個聽嘅過程之中咧，可能你已經係有提問㗎啦嚇。如果你有嘅話咧，你唔使等到，或者我哋唔建議你等到咧最後咧先至問我哋。你點樣問我哋咧？你係需要打電話嚟俾我哋啦嚇，打返嗰個0292127789個電話啦，又或者咧你可以發信息嚟我哋嘅手機電話0428183882嗰個電話咧嚇，你可以發一個信息俾我哋，或者打呢個電話俾我哋咧嚇，話俾我哋聽咧你嘅問題嚇，咁我哋咧就會喺呢度咧代你咧去問嘅。咁由於咧我哋唔想大家到最尾完講座之後咧好多電話打入嚟咧，我哋會聽唔切，咁所以我哋希望你咧係能夠陸續，如果你有問題你就寫低佢，然後你就打電話嚟俾我哋嚇，咁我哋咧會通過翻譯員咧係幫你問咧，然後喺呢度解答嘅嚇。咁但係咧，如果你之後先至睇呢一個而家我哋呢個講座嘅 video 嘅話咧，到期時你睇嘅係錄影嘅嚇。咁譬如你聽日睇啊，或者今晚睇啊，或者2個禮拜之後睇咧，咁喺嗰個時間咧，你係冇可能咧係問問題㗎啦，因為呢個問題嘅時間、提問時間咧，淨係俾而家你睇緊直播嘅朋友嘅，好嘛？咁喺呢度希望大家能夠明白哈。跟大家解釋一下，如果你有問題的話，我們建議你能夠呢打電話，屏幕上面有顯示電話號碼到我們更生會不要等到整個講座結束的時候才問因為呢怕很多朋友都在結束的時候問呢，我們會來不及聽也來不及問所以我們希望你一路聽，你一路有提問，或者你現在已經有問題的，歡迎你現在就已經可以開始打電話給我們，或者發信息給我們，都是可以的，我們會替你 通过翻译来问我们的讲员，好吗？在这里也提醒一下，如果你是看重播的，就是不是现在我看好像我们直播的朋友的话呢，到时候是沒有這個提問時間的。這個提問時間只是給今天星期五10點半到12點直播的朋友是可以提問的，好嗎？咁事不宜遲啦咁我哋好快咧就將呢個麥克風咧就交俾我哋嘅嘉賓啦咁我哋今日嘅題目咧係有關於前列腺癌咧同對性生活嘅一啲嘅影響啦咁呢個題目咧可能咧對於無論係西人又好或者係我哋華人都好咧，可能都會有啲尷尬去講到呢個問題嘅咁我哋今日咧就通過我哋一位嘅專科護士咧喺我身邊嘅叫 Bernie 咁佢咧就將佢嘅經驗咧同我哋分享有關於前列腺癌，有關於佢哋性生活嘅影響，同埋咧有啲乜嘢嘅建議俾大家，好嘛？希望咧能夠開咗呢一條路咧，就係話如果你有遇到問題嘅時間咧，唔使覺得尷尬歡迎你咧係去尋求一啲嘅幫助，尋求一啲專業人士嘅一啲嘅佢哋嘅經驗嘅分享等等，好嘛咁在我身邊呢是我們的今天來跟我們講座的這個一位專科護士，是前列腺癌的專科護士，他跟我們分享的題目是有關於前列腺癌對性生活的影響。那這個題目呢，可能對華人也好，洋人來說呢，都可能有點尷尬，或者是好像有一個禁忌，兩者不一定會經常說但是我們希望通過我們專科護士的一些的專業的意見，以及是他的經驗的分享的話呢，讓大家可以看到呢，有問題我們就面對它，好嗎希望呢能夠解決或者減輕所以呢，我們很快呢就把時間呢就會交給我身邊的這個 Bernie 那好，謝謝大家那我們就先開始今天的講座。Yeah, I just introduce you. Yeah, thank you very much, Bernie.
Thanks, Emily. Thank you. Hi, everybody. My name's Bernie. I'm from Macquarie University Hospital. I've been a prostate cancer specialist nurse there for around about 2.5 years. So prostate cancer specialist nurses are nurses who are specifically trained in prostate cancer, and we're placed in hospitals around Australia. At the moment there is around 50 of us around Australia, and we have funding to go to around about 100 nurses by 2023 around Australia. So we provide support and be an ongoing point of contact for our prostate cancer patients in our local health area, but in our hospital or wherever we're placed.
大家好，我是这个 Benny， 然后我是一名这个专科的前列腺的这个护士，然后我已经在这个医院里面这个工作，然后从事这个职业超过2年半的这个时间。然后我们的话，目前这个前列腺专科护士的话，都是一群受过这个专业对于这个前列腺癌的培训的一群护士们。然后目前的话，我们大概是有50名这样子的这个人员，我们游走在各大悉尼的各大医院还有社区当中，去帮助我们的这个病人。然后我们也得到了一些这个拨款，然后到2023年的时候是预计我们的人数可以到达这个100人。然后我们的工作的话，都是不管在我们的当地的社区当中，或者医院里面，希望可以提供帮助，以及如果我们的前列腺病人有需要的话，然后可以联系我们。
So my talk today is about prostate cancer and particularly the sexual issues which go with prostate cancer. So we'll have a little discussion around that. There will be things of an explicit nature, but we'll try and keep those to a minimum. But obviously we're talking about sex, and we're talking about the problems that happen after prostate cancer, and so that's what we're talking about today.
所以今天的话，我们会给大家讲解一下这个前列腺癌，然后重点的话也是关于这个前列腺癌对我们这个性生活方面的这个影响。然后我们也知道的话，讨论这些话题可能会稍微比较尴尬一些，我们会尽可能的减少这种比较难为情的感觉。但是这个始终是我们今天的这个重点，就是在这个有前列腺之后，有可能对于性生活所产生的一些影响或者问题。
what we're going to cover today is just a little bit about, what a prostate is, and then a little bit about prostate cancer in general. So how it evolves and the problems of prostate cancer. Then we're going to talk a little bit about the treatments that are on offer for people who have prostate cancer. Then we'll talk about the problems that those treatments can cause in your sexual function. And then we'll talk a little bit about how we get over those, how we can treat those. And lastly, the two things we'll talk about is, your sex life going on after prostate cancer, how we can continue that, but also our relationships as well. So we'll talk a little bit about intimacy.
所以这个我们今天的话也会跟大家主要讨论一下，然后介绍一下我们的这个前列腺，然后跟大家这个讲一下关于这个前列腺癌，然后它有可能会造成一些什么样的这个问题，以及跟大家说一下目前的话对于前列腺癌我们这个存在的一些治疗方案，以及这些方案的话有可能会怎么样影响到我们这些病人的这个性功能，以及如果万一这些问题出现的话，我们可以有一些什么方法来解决它们。然后最后2点的话，也会跟大家这个说一下，这个患有前列腺癌之后，我们的这个性生活是怎么样的，以及会跟大家说一下和这个伴侣的这个关系，以及他们的亲密关系。
So, what's a prostate? A prostate is a small walnut-sized organ which sits between the bladder and your penis. And essentially it's a sexual organ. So it's an organ which produces the fluid which protects and nourishes your sperm, and it ejects that fluid when you ejaculate, when you orgasm, when you go to have sex or have an erection, you produce this fluid, and then it is ejected from the semen, from the prostate, to protect the semen, so that when your sperm remains viable, and you can then impregnate a person if that's what you're trying to do. So it's effectively trying to protect the sperm on its way to do what it's got to do.
所以这个前列腺，那前列腺的话，其实它是一个比较小小的核桃状的大小的一个这个器官，然后它是位于我们的这个膀胱还有这个阴茎之间的一个性器官，然后是属于我们生殖器官之一。然后它的一个作用的话，就是当我们这个有这个勃起，然后射精或者高潮的时候，它都会分泌一些这个液体，然后来包裹着以及保护着我们的一些这个精子，使得我们的精子的话可以保活它的这个活性，然后等到达到这个子宫的位置的时候的话，就可以使得这个另一半然后去怀孕，然后主要它的这个工作的话，其实就是保护我们的精子。
So, what can go wrong with the prostate? Well, obviously the prostate can grow over time. And sometimes that growth is normal growth, and that causes problems with men's waterworks. So as men get older, sometimes what happens is the way that they pee is affected. So they may have a slower flow, find it harder to pass urine. But sometimes, and usually, that is not a sign of prostate cancer. Usually that's a sign that there's something benign going on in the prostate.
那我们的前列腺的话，有可能会出现一些什么样的问题？我们前列腺的话，其实它随着时间的话，是会慢慢的这个生长或者变大的。然后随着很多这个男性，随着他们年纪慢慢变大的时候的话，这个前列腺的话，都有可能会有这个肿大的情况。然后这个就会导致可能他们小便受到影响，然后可能小便流速比较慢，或者小便的时候有困难。但这些的话是属于正常的，并不是癌症的一些现象，更多意味着的可能是一些这个前列腺一些良性的发展。
But sometimes cells continue to grow, and sometimes they divide in abnormal patterns. And this is generally what we think goes on in the cancer process. So cells divide, cells multiply, and they grow and they mutate. And this is what this is how cancer develops. And so for prostate cancer, those cells divide, those cells multiply. Sometimes they are contained just within the prostate, but sometimes they spread through from the prostate via either blood vessels, through the lymph vessels, so the vessels which carry the nutrients out into the body and filter our body, and then they spread elsewhere.
然后，但是的话，我们的这个有些时候，在这个前列腺当中的一些细胞的话，它们在生长过程当中的话，会形成这个异常，然后会繁殖。然后当它们这个繁殖，然后突变的时候，这些异常的这个细胞的话，就会这个形成癌症。然后这就是我们前列腺癌如何形成的一个过程。然后，当我们有这些这个前列腺癌的时候的话，有些时候它这些细胞的话都会这个留在我们的前列腺当中，但是有些时候这些前列腺癌的细胞的话，有可能会通过我们的这个血管或者我们的淋巴腺，然后扩散到身体的其他部位。
So where does cancer spread when it spreads? So usually when prostate cancer spreads, it spreads to outside the prostate to the lymph nodes. Now the lymph nodes are small, small little, if you like, filters which filter different bits of our nutrients which travel around our body, and so they're all over our body. So sometimes prostate cancer spreads to the lymph nodes which are in the groin, around our pelvis and around our bladder, and then it quite often will go into our bones, and that can be anywhere in our bones. Quite often it's near the prostate, so it's in the pelvis, it's in the spine, but then it can spread anywhere in your skeletal system. So from head to toe, it can spread into any of those bones if cancer grows, or if it's untreated, or if it's quite aggressive. It can also spread into some organs, usually sometimes your liver, sometimes your bladder, and it can then go on to affect those organs as well.
然后我们的这个前列腺癌的话，它也有可能这个会扩散到身体的一些其他的部位，然后主要的话是通过我们的这个淋巴腺以及淋巴系统的。我们的淋巴系统的话，其实是我们身体的一个这个过滤器，然后它也是负责把很多营养输送到我们身体各个部位的，所以我们全身的话都由这个淋巴系统所覆盖着。这也就意味着我们的这前列腺癌的话，有可能会通过这个淋巴系统，然后扩散到身体其他的一些部位，包括我们的这个属膝部、我们的盘骨、我们的这个膀胱以及骨头等等的。然后如果是发现在这个扩散到骨头当中的话，也可能发生在身体任何的一个部位。比较常见的部位的话，就包括我们的盘骨以及我们的这个腰椎。但是我们全身从头到脚的这个骨头的话，都有可能会受到影响。特别是我们这个癌症的话，没有接受到这个适当的这个治疗，或者不知道，或者它这个癌症是属于比较恶性的。当然的话，它也有可能会扩散到其他的一些这个器官，包括我们的这个肝脏，还有这个膀胱。那如果是这种情况的话，那该器官也会受到这个癌症的影响。
How many men does it affect? Well, it affects a lot of men. The statistics are around about 1 in 7 men by the age of 75 will get a diagnosis of prostate cancer, and 1 in 6 men by the age of 85. So there's about around about 20,000 men diagnosed with prostate cancer each year, and there's around about 200,000 men living after a diagnosis of prostate cancer currently in Australia. Around about 220,000 I should say.
那这个我们也给大家介绍一下相关的这些数字。然后其实目前的话，前列腺癌也这个影响着很多人。根据相关的数据的话，这个到75岁的男性当中的话，这个会被诊断出有前列腺癌的这个概率大概是每7个男性当中的话会有1个，然后85岁的人群当中的话，就是每6个当中会有1个被确诊有这个前列腺癌。每一年的话，大概我们有2万人被确诊有这个前列腺癌，然后目前在澳大利亚的话，大概这个有22万人，然后是和我们这个前列腺癌共存的。
So you can see that there's a lot of men living out there with the effects of treatment throughout the years. So what are those treatments? There's numerous treatments for prostate cancer, and it depends on the nature of the cancer, when it's caught, and also the well-being of that person. So we'll go through those in a little bit.
所以的话，也这个意味着说，有很多的这个病人在我们这个社区当中，通过接受治疗，然后是这个和我们的前列腺癌共存的。那这些治疗都分别是什么呢？然后其实治疗的话，我们也有很多种不同的治疗的方法跟方案。这个是需要取决于这个癌症本身，它是否这个恶性的程度是怎么样的，以及我们这个发现的这个时间点。同时的话，也需要看我们这个病人本身的身体，然后这一些的话，等一下都会给大家做一一介绍。
So for some men, they have a cancer which is very low grade. So it's contained within the prostate, and the nature of the way those cells have formed and mutated, we can see under a microscope that these cells haven't mutated and don't look potentially aggressive. We used to look at prostate cancer and say, you've got prostate cancer, you need it treated, and that's end of story. With a lot of research and a lot of looking at data from statistics of prostate cancer over many years, we now know that many men have in the past been over-treated for prostate cancer. So they've had radical treatment, either radiotherapy or removal of the prostate for a cancer that they may never have caused them a problem in their lifetime. That is, it may never have gone beyond the prostate, and it is more than likely something which may never might not have killed them. Okay, so we know those cancers may never cause a person a problem. So we group those cancers, and what we do with those cancers now is something called active surveillance.
所以的话，我们这个一给大家介绍。首先，第一种的话，其实有一种的这个前列腺癌的话，它是属于这个低度恶性的这个癌症。那其实它是什么呢？就是当我们给病人做检查的时候，然后我们抽取他的一些细胞，然后拿去这个化验所放在这个微显镜上面看的时候，都发现其实他们的这个病变本身或者它的这个并没有扩散到其他的一些部位，它还是留在我们的这个前列腺那里。然后在过去，其实当我们 碰到有这个前列腺癌的病人的时候的话，其实就是马上开始治疗。然后，但是那么多年以来，我们也做过很多相关的这个研究，以及看过了一些数据，都发现可能过往的话，很多的这个患有前列腺癌的男性，可能他们接受的这个治疗都是属于这个过多的。可能一发现他有前列腺癌，我们就会给他做根治性的这些治疗，包括把前列腺切除掉，或者给他做这个放射治疗。但其实那个癌症本身的话，可能对于他的生活并没有什么影响，它也是属于这种低度恶性的这个癌症，它并不太可能会扩散到身体的其他部位，也不会这个危及生命。所以现在的话，我们都把这种类型的这个前列腺癌的话，把它分组成为这一个低度恶性的这个癌症，然后我们现在所采取的这个治疗方案就叫做主动监测。
And so active surveillance, that's something where we're watching your cancer and watch what happens to it over time. So it's not that we're not treating your cancer, it's that we're watching to see whether this cancer is something which is going to grow, and then we jump on it and we offer treatment at that stage. Or is it something that, is never going to cause you a problem? So what do? We do regular PSA tests, so a blood test, watching the trend of what your PSA is. So PSA is a particular blood test which can show us activity in the prostate. Now, it doesn't mean that you have prostate cancer if you have an elevated PSA, it just means there's activity within the prostate. So we look at the trend of your PSA. We do, if there's movement in your PSAs, we also look at an MRI, so a scan, an MRI using magnets to look at your prostate and see whether there's any lesions in your prostate which are changing size or nature. And again, if there's changes in your PSA, if there's changes in your MRI, then we do a biopsy or offer a biopsy to see whether there's changes in the nature of the cancer, and then we base our treatment based on that biopsy to see whether you still have a low-grade cancer or whether you have a cancer which is developing.
所以我们的这个主动监测的话，其实简单来说，就是我们会在这个定期，然后去观察这个前列腺癌以及我们病人的这个情况。观察的话，也并不意味着说我们并不会这个治疗，只是我们会保持观察，然后如果它有一些这个发展的话，然后或者一些病变有需要的时候，我们就会介入这个治疗，然后去看看到底那个时候是需要治疗还是不需要治疗的。一般来说的话，我们都会给病人做定期的这个血检，然后去看看他们的这个 PSA。PSA 的话，就是我们前列腺的这个指数，然后主要是看看它的一个指数，还有趋势是什么样的。然后，就算有些时候我们在血检当中发现这个 PSA 前列腺指数比较高，或者比之前高的话，也并不意味着就有了这个癌症。然后主要还是得看它的一个趋势是怎么样的。一般如果已经有前列腺癌，然后在定期的这些血检当中的话，我们医生发现这个 PSA 前列腺指数是有升高，那一般我们会安排病人去做一个 MRI 核磁共振，去看看里面的这个前列腺癌有没有一些这个病变，看看它的这个大小或者本质有没有变化。如果 PSA 前列腺指数还有我们的这个核磁共振显示都有一些变化的话，那医生很有可能就会建议病人去做一个活检。那根据活检的结果的话，再去商讨以及这个考虑治疗，看看到底这个依旧是一个低度恶性的癌症，还是说它已经发展成为比较恶性的癌症。那个时候我们就会介入治疗。
So if a cancer is localized just to the prostate, and we can do scans to see whether that is the case. So we have special scans now that can tell that are specific for prostate cancer, and quite often when we have a higher grade prostate cancer, we do a special scan to see whether there are any growths outside the prostate. So if there aren't any growths outside the prostate, then we offer radical therapy. Now that comes in various forms, and that's where some of our side effects start to come in. So one of the options for treating localized prostate cancer is removal of the prostate, called radical prostatectomy. And that can be done in several ways. That can be done with an open operation with a larger cut in your abdomen. That can be done with a robot with small incisions, or it can be done with keyhole surgery. And there's also various ways that the operation can be done, either preserving the nerves which wrap around the prostate, or if your cancer is a little more extensive, or if the cancer is pushing on the edge of the prostate, sometimes those nerves are not able to be saved. And we'll talk a little bit later about the importance of those nerves.
然后接下来的一些这个治疗的话，也有分这个看看我们的这个前列腺癌是否是局部性的，就是它依旧还是保留在我们的这个前列腺当中，并没有这个扩散到其他的一些部位。然后我们现在的话也会做一些这个特别的扫描，针对这个前列腺癌的，看看它是否有这个扩散的现象，然后也看看它是否是变成了是一个属于高度恶性的这个癌症。如果它并没有扩散，依旧是局部性的前列腺癌的话，那么我们一般的话就可能考虑或者提供这个根治性的这个治疗。根治性治疗的话也分很多种，那这些治疗的话就有可能会给病人带来一些这个副作用。那如果它还是这个局部性的话，那我们的这个根治性的治疗就包括我们的手术，手术也有很多不同的这个形式，然后可能包括一个传统的这个开肚子的一个手术，然后用一些这个机械手臂，或者我们的这个微创手术。然后手术本身的话也有很多不同的这个做法，然后基本上的话是看能不能这个保留我们的这个前列腺旁边的一些这个神经，那这个是取决于我们的这个癌症到底是怎么样，以及它的这个大小跟位置。有些时候的话，如果癌症比较大，有可能这些神经就保留不下来。那我们等一下的话，也会跟大家再细聊这些神经对于我们的这个病人的一个重要性。
Another option for treatment of prostate cancer is radiotherapy or radiation therapy, and that comes in various forms. Sometimes it's done by external beams, where you go into a radiotherapy centre, you lie on a bed, and they shine beams and aim them at the prostate, aiming to kill the cells within the prostate. So that's one form of prostate cancer. It takes about between 5 and 10 minutes, and it's done anywhere from around about 20 days sometimes up to around about 8 weeks. So Monday to Friday, 5 days a week for anywhere up to around about 8 weeks. Another form of radiation is brachytherapy. So brachytherapy is the implantation of radioactive substances into the prostate. So that can be done by the form of permanent seeds which are implanted in the prostate, or you can have, for higher grade cancers, they offer high dose radiation into the prostate, and so that's special needles which go into the prostate under an anaesthetic. Dose of radiation is delivered, and the same thing, aiming to kill those cells within the prostate. Now sometimes that's combined with extra external beam radiation. There is another evolving form of brachytherapy, where if you have an isolated lesion of prostate cancer determined on scanning, you can have a treatment to just that area. Now it's called focal brachytherapy, and it's an evolving area within not only radiation but through various means as well. So there's lots of treatments for focal therapy evolving with evidence being developed for these evolving treatments.
好，然后我们接下来的话也继续跟大家介绍我们其他的一些这个前列腺癌的这个治疗，然后我们也包括了我们的这个放射性的这个治疗。那放射性治疗的话也分为很多种，首先第一种的话就是这个外放的这个放射治疗。然后一般的话都是可能这个病人会到一个这个放射中心，然后去躺在床上面，然后这个会看到会有一些仪器，然后去针对这个前列腺的这个部位，然后去放射一些这个一些治疗或者一些光束，然后尝试杀死那些异常的这个细胞。一般整个过程的话只需要5到10分钟，然后一个疗程的话可能是20天到8周不等。一般的话都是周1到周5，然后都得做，然后最长的话做8周的一个时间。另外一种的话，我们是叫做这个近情的这个放射的这个治疗，然后一般这个的话其实就是采用一个手术的一个方式，把一些有放射性物质的一些种子，然后可能永久性的植入到我们的这个病人体内，然后在这个前列腺附近。然后这个也得看它这个癌症本身是否是一个这个高度恶性的这个癌症，然后整个的这个过程的话是会在这个麻醉的底下去进行，然后这个医生的话会把一些这个针，然后以及有一定量的这个放射性的一个物体，然后放进去。有些时候的话，我们会把这个外放跟近情的两者都一起做。然后现在，因为我们也这医学比较昌明，所以也有很多这个不同的一些研究，有一些新的这个方法的话，是一个针对近情的这个放射性治疗。然后我们是针对性的，然后如果我们在扫描当中发现可能病人的前列腺癌有一个新的这个病变的话，可能可以就这个位置，然后做一些这个针对性的一个治疗。
So another type of treatment for prostate cancer is hormone therapy or androgen deprivation therapy. This form of treatment is used in higher grade cancers, often combined with radiation therapy. So for people who have prostate cancer, which may be high grade with the potential to spread quickly or spread beyond the prostate, or for men who have prostate cancers which might have involvement with a lymph node outside the prostate or a small amount of disease in the bones. So that's one form, one time when we use it. We also use it when cancer has recurred. So if prostate cancer, you have an operation or you have radiotherapy and then it comes back, we quite often start people on hormone therapy to slow the growth of the cancer and to try and stop it from spreading to other areas. The reason behind this is testosterone is a substance which is made in the testicles and it's the fuel for prostate cancer. So we're aiming to reduce the testosterone so that stops the fuel for the cancer to grow.
接下来的话，给大家说一下我们的这个雄性这个激素，我们的这个剥夺治疗的这个方法。然后这个的话，一般我们会在2种情况之下，然后会采用这一个治疗的这个手段。第一个的话是针对那些这个高度恶性的这个癌症，然后很多时候的话都是跟我们放射性的这个治疗一并使用的。然后特别是如果我们这个发现这个癌症的话，是有可能这个会扩散到身体的其他的一些部位，或者我们发现可能这个病人这个的前列腺癌附近的一些淋巴腺或者淋巴结的话受到影响，或者当我们这个通过做扫描跟检查发现骨头也受到一定影响的时候，会比较采取这样子一个激素的一个治疗。 第二种情况的话，就是当我们的前列腺癌复发的时候，可能病人本身的话已经做过了这个之前手术或者这个放射性治疗，但是不久之后的话，这个前列腺癌又复发了。那么在这种时候的话，我们一般可能都会建议病人用这个荷尔蒙或者激素治疗，主要的目的就是减缓我们这个癌症的一个发展或者扩散到身体其他的一些部位。然后它的原理的话，其实也是比较简单。我们身体当中的话，有一个这个激素叫做这个睾丸素，它是由我们的睾丸所分泌出来的。然后它在这个癌症当中的话，特别是这个前列腺癌，就是它的前列腺癌的一个能源。所以，当我们尝试着把这个睾丸素降低的时候，其实就是减少它的这个前列腺癌的能量。
So prostate cancer sometimes becomes very smart, and it becomes resistant to that suppression of your testosterone and starts to grow or find other fuels for its growth. So it can make its own testosterone, or it can make its own fuel and grow itself. And so that's where newer drugs target those pathways. And sometimes we also give chemotherapy, which is aimed at sort of killing off cell cycles and mutations. And there are newer drugs which target different DNA type of mutations, so the formation of those cells. And so I won't go into those, but there are lots of new drugs being developed which target different genetic mutations or different pathways of growth of prostate cancer and cell mutations.
当然的话，我们这个前列腺癌的话也是这个很聪明的，有时候随着时间的话，它有些时候会产生这个抗药性，然后它可能自己的话会找到别的一些能源的这个来源，或者它自己本身的话就已经发展到了可以自己去分泌一些这个睾丸素。然后在这个，因为这些的话，我们医学界的话也一直在研究很多的这些新药，然后也是针对这一点的。然后有些时候我们也会给病人采取这个化疗，然后主要就是希望可以这个杀死或者破坏我们的细胞以及它的这个突变的一个周期。然后现在也有很多不同的这个新药去针对我们不同的这些基因或者 DNA 的这个突变，但是我们不会这个跟大家说的太复杂，但是只是想要跟大家说的就是，以目前来说的话，也是有很多不同的新药，然后是可以有效的针对这些不同的基因突变的。
And so you can imagine, and so many of you may know yourself, that a diagnosis of cancer or a diagnosis of prostate cancer can change your life and be very stressful when you first find out. And this stress itself has been shown to have significant impact on your sexual function to start off. So many men report, or many cancer survivors report that they're less interested in sex and they have less sex, or whether that's by themselves or with partners. So there's less interest, and this is where the whole vicious cycle can start in terms of distress in men and distress in partners around prostate cancer and its treatments. And thus the importance of having a prostate cancer nurse, someone that can explain their treatments, their side effects, and what they can do about those, and talk and relieve some of that stress, relieve some of that anxiety.
然后在我们的过往的经验当中的话，我们也这个知道，包括可能现在在看我们这个讲座的观众，然后在刚刚一开始被诊断有癌症或者是前列腺癌的时候的话，可能生活都遭受了一个很大的一个变化。在刚刚得到消息的时候，肯定也是非常的这个压力会特别的大。然后这个压力的话，其实本身的话，对于我们的这个性生活或者这个性功能的话，也是有一定的这个影响的。在过往的话，也有很多不同我们的这个患有前列腺癌的这个病人，然后跟我们说，可能他们对于这个性欲，然后是有这个减少的，然后他们的进行性行为的这个次数也比之前要这个较少，不管是自己本身的性行为，还是跟伴侣一起的。所以当有这种情况的时候的话，有可能就是因为这种压力，然后这跟我们的伴侣的一个关系，然后造成了一个恶性的一个循环。这就是为什么这个当有前列腺癌的时候，然后是非常重要的去咨询一下我们的这个专科护士的一些这个建议，他可以给大家解释一下关于目前所接受的一些治疗是怎么样的，有可能会出现的一些副作用都包括哪一些，那当有副作用的时候可以做些什么，以及的话跟那些护士谈一谈，然后去尽量减少或者给自己减轻这个压力跟这个焦虑的感觉。
So we'll talk a little bit about surgery now. Surgery is an option which around about sort of I'd say 80 to 85% of men choose if their cancer is contained within the prostate. And so it's something where your side effects are quite often up front. So the main side effects of surgery are on your continence. So there's a tap between your bladder and your penis, and so that tap is disturbed during the operation, and for many men they leak, sometimes for a short period, but sometimes for life. And then there's the sexual side effects.
接下来的话，给大家讲解一下这个手术以及手术过后的话，这个有可能会导致的一些这个性功能的一个障碍。然后一般来说的话，如果这个前列腺癌并没有扩散到这个身体其他的部位的话，可能大部分的这个病人有80%到85%左右的都可能会选择做这一个手术来解决这个问题。那做手术之后的话，就会有可能会出现一些比较明显的这一个副作用，其中的话就包括可能会有尿失禁的情况。因为我们人体的结构的话，就是我们会有这个膀胱，然后我们会有这个阴茎，然后它们中间的话，其实会有一个像类似水龙头一样的一个东西。那当我们做完手术之后的话，这个水龙头就遭受到了这个破坏，所以术后的话，很多的病人都有可能会出现这个有漏尿的这个情况。那这个情况有可能是这个暂时性的，然后有些时候的话，有可能是永久性的。然后同时因为这个的话，有可能也会影响到他们的这个性功能。
So for many men, they're worried when they get a diagnosis of prostate cancer and they're faced with surgery. Most men say, get the cancer out of me, get me well, get me dry, and then I'll worry about everything else. And that everything else is the sexual function. And men don't like to talk about that. But we need to inform them before they go ahead with radical treatment what those changes are. And so first up, if you is the effect on your fertility, so your ability to father more children. So the channels, because the prostate produces the nutrients which nourish the sperm, you can no longer father children unless you sperm bank before treatment. And so that's the first side effect.
然后我们很多的这个男性病人的话，他们这个可能当被诊断出有这个癌症的时候，前列腺癌都会比较这个担心，然后就说哦，想要这个做手术，对吧？就把它切除掉，把癌症都切掉，然后让我这个小便没有问题，那就可以了。剩下的我们这个就再说吧。然后很多时候他们所这个剩下的这些部分，意味着的其实就是他们的这个性功能或者这个性生活。但其实的话，在做这种根治性的手术之前的话，也必须要这个了解到这方面的这个信息，以及做完之后有可能会出现一些什么样的改变。首先第一个的话，有可能会出现的就是不育症，然后有可能之后的话，就做完这个根治性手术就没有办法这个生孩子了。因为我们之前也有跟大家介绍到，这个前列腺的一个功能的话，就是会分泌一些这个液体来保护我们的精子。那当失去了这个功能之后的话，我们的这个精子可能就没有办法使得它这个怀孕，所以就会可能生孩子方面出现问题。除非是在术前的话，然后到精子银行把自己的这个精子存起来。
And so, obviously, for men with the channels, with the loss of the prostate, and the way the operation is done, we effectively give men a vasectomy by closing the channel between the testes and the penis, and so therefore they have dry ejaculations. Now, sometimes men can still pass some fluid, and that's I don't want to say condition, but that's something called climacturia. So sometimes at the point of orgasm, men can still leak some fluid, and it's a small amount of urine. For some men, that improves as their continence improves, but for some men, that doesn't improve. Usually it's only a small amount, but some men can lose a lot of fluid from their bladder at the time of orgasm. Now, the way to get around that is firstly to empty your bladder before you go to have sex or you masturbate, so that limits the amount of fluid. If it is happening, you could try using a contraceptive, so a condom, and also you could mask it by using some lubrication so you're less aware of that happening, and also popping a towel underneath to soak up that fluid.
然后我们这个做完手术之后的话，因为这个前列腺切除了，然后他们在做手术的时候也会把我们这个连接我们的这个睾丸，还有我们的这个阴茎的中间的管道，然后也会把它这个绑着，所以当这个术后的话射精的时候，有一些这个会出现的情况，就是会这个干射精，然后或者他们只会这个有射精的时候的话，会射出一些这个液体。它这个其实也并不是一个什么病，但是它是会有可能出现的一个情况，就是在性高潮的时候有可能会出现这个尿失禁，或者有部分的这个小便，然后会随着性高潮的时候射精的时候一并射出来。对于有些病人的话，当他们尿失禁的情况变得改善的时候，这方面也会有所改善，但有些病人方面的话是没有的。然后量的话也因人而异，有些病人的话他只会这个射出一小量的一些这个尿液，但是有一些病人的话是会挺多的。那如果万一真的有这种情况，那么我们有一些什么样的解决方法呢？那么第一个，我们是建议在进行这个不管是性生活、性交或者这自慰之前的话，然后先去把这个膀胱清空，先去小便。然后第二个的话，就是可以采取这个像保险套或者一些润滑剂，然后来这个减少这种情况。然后还有 另外一种的话，就是可以做好准备，比如说放一个毛巾在底下，然后万一这个出现的话，那这个也有毛巾在底下垫着。
And so there's some of the functional changes, but also one of the most talked about changes is the effect on men's erections after surgery. And so we know around about 50% of men may not get their erectile function back. And for some men that's not a problem, but for many men that is a problem. And the effect is almost immediate after the operation. And recovering function is often quite difficult and depends on the strategy used during surgery, whether nerves were able to be saved or not, and then how willing or how far people want to take the options of rehabilitation to recover those erections. So the erections are lost almost immediately after surgery. Obviously there's little desire while you're in that post-operative period. But for some men, those erections can return within weeks. But usually in terms of erections, we talk in terms of months to years of recovery. We know that nerve recovery in general can take up to 18 months to 3 years to get back to its best. We usually use the analogy, if you cut off your finger and have it sewed back on, the nerve endings in your finger will take around 18 months to regenerate and for you to get feeling back in that finger. So we're not cutting your nerves during the operation, we're moving them away from the prostate, and that sends them to sleep.
然后这些就是可能在这个功能方面的一些这个影响，然后另外一个有可能会受到挺大的影响的话，就是我们的这个勃起的这个功能，然后大概在这个50%的病人当中的话，然后他们是可以这个获取的，就是可以在之后可以再有勃起的这个功能的，然后但是在做完手术之后的话，这个是基本上是会失去了这个勃起的这个功能。当失去勃起功能之后的话，当然对于有一些病人的话，这个是不是一个问题？对有些病人的话，可能是一个困扰。然后之后的这个恢复的话，也得看看这个病人本身的这个努力，然后也得看在手术过程当中的话，然后关于我们之前所提到的那些神经有没有受到这个影响。但是在这个术后的话，失去这个勃起的功能基本上是一定的，然后可能有些病人需要几周或者甚至几个月甚至几年的时间才会慢慢的这个恢复，因为当我们的这个神经受到影响，它一般可能需要18个月到3年的时间，然后才会这个恢复到它的这个最佳的这个状态。然后其实如果想象一下，就比如说手指切到了，然后影响到神经，就算之后把它缝起来的话，大概也需要18个月，这些末端神经的话才会慢慢长回来，然后那根手指才会慢慢有感觉。那在我们的这个前列腺的这一个部分也是一样的，手术过程当中的话，我们不会直接把这个神经直接切除掉，但是我们会把它们放在一个别的位置，然后通过这样子做的话，有些时候就会使得这些神经进入一个睡眠的状态当中。
So we'll talk a little bit about nerves now and the importance of nerves. So nerves, the nerves run from your pelvis around your back passage across the top of the prostate and down into the penis. And usually what happens to create an erection is, usually with blokes, we think about something, we see something, and that starts an excitation process, so we get excited, and our nerves effectively act as a switch to open up the blood vessels to create an erection. So that's the importance of nerves in terms of creating an erection. So for men, we usually have 3 or 4 erections of a night time. Sometimes we know about these, but sometimes we don't. Sometimes we wake up with it, so we know about that one, but quite often we don't know. And they're effectively what's keeping the tissue in the penis healthy and the muscle strong in the penis. So you can imagine if you don't use your arm, your bicep, for 6 months or weeks, then that muscle starts to waste away. So after surgery, our nerves go to sleep by us moving them or cutting them, and we don't get the continuous blood flow of a night time into the penis. And so like any muscle or like any tissue which is not getting blood flow into it, that tissue narrows, and so we lose a little bit of length and we lose a little bit of girth. So the penis itself can retract or narrow, and as a result, it looks sometimes like your penis is smaller. Okay, and so that's effectively the effects that loss of nerve function can have on your penis.
然后我们接下来也跟大家介绍一下我们的神经以及它的重要性。然后简单来说的话，其实我们的神经都会在我们的盘骨，然后我们的肛门，然后我们的前列腺，还有睾丸，然后都会有的。当我们想到或者看到一些东西的时候，然后我们就会比较兴奋。然后当这些神经然后有感觉的时候的话，它们就会发送信号，然后去增加我们的那个部位的一个血液的一个流量跟血液循环。然后当血液都冲往那个地方的时候，那就是会造成我们的勃起。那一般男性的话，在自发的每个晚上可能都会有3到4次这样子的一个过程。有些时候我们是有感觉，我们知道；有些时候是不知道的。然后早上起来的时候，如果有晨勃的情况，那么我们就知道，其实它就是在这个过程。这个过程的话，是我们身体使得我们的任何的组织或者肌肉保持活力更健康以及力量的一个方法。对吧？我们可以想象一下，简单的，就比如说，如果有只手，有6个月的时间没有去动或者怎么样，然后没有血液的供应，然后它的这些组织跟我们的肌肉的话是都有可能会萎缩的。那我们刚刚说到，通过手术的话，不管是切掉或者改变这些神经的位置，有可能会使得他们进入睡眠的状态，那它就是失去了每一天的这样子一个正常的血液的一个供应跟循环。那久而久之的话，我们的睾丸的肌肉还有组织有可能就会萎缩，所以就会发现有些时候长度或者周长的话会有所改变，然后可能会觉得说比之前更小了，然后这一些的话都是有可能会出现的一些情况。
So quite often the goal of therapy after surgery is to have a replacement for that loss of blood flow. So while the nerves are asleep, we give medications or encourage stimulation or by devices or yourself to open up the blood vessels to create blood flow back into the penis, to keep the penis healthy until such time as those nerves start to recover. And I guess one of the other things just to be aware of is that at the point of orgasm initially it can be quite painful. So you can still have an orgasm without an erection, and we'll talk a little bit about that later. But initially it can be quite uncomfortable and painful. Now you're not doing anything wrong. It's just that the area is getting used to the new plumbing arrangement. So it can be just a little bit uncomfortable, and usually that improves over time.
所以在我们做完术后的话，这个治疗的一个这个目的，其实都是可以看看有一些什么这个方法，然后可以使得这个我们痉挛的这个血液循环的话是可以恢复。然后有些时候的话，我们有可能通过这个药物的帮助，或者是一些不管是自己本身，或者使用一些这个工具，然后去刺激我们的这个部位，然后使得它这个保持这个血液的一个供应，然后循环，直到我们的这些神经慢慢的这个恢复。然后还有另外一点想要提醒大家的就是，就算其实我们没有这个勃起，其实还是可以达到这个性高潮的。但是在术后的话，刚开始的时候可能是会比较痛一点，或者是比较不舒服。那这些情况是正常的，并不是你这个做了什么，然后只不过是因为他做完手术之后，这个所有整个可能系统啊，很多这个东西都跟之前不一样，然后很多时候的话，随着时间这种情况的话都会有所改善。
So we'll talk a little bit about radiotherapy and the side effects of radiotherapy now. Quite often the side effects of radiotherapy are delayed because we're not immediately causing changes to the anatomy like we are in surgery. So the onset of symptoms can be sometimes you get a little bit of some disturbance while you're having treatment, but usually in terms of when those symptoms come on and the sexual side effects as well as the continence or urinary side effects can be anywhere from 12 months onwards, but sometimes they are 2 to 3 years down the track.
然后接下来的话也跟大家说一下，就如果采取这个放射性治疗或者这个放疗的话，有可能会出现一些什么样的这个副作用。那最大的不同的话，就是它的一些副作用的话，可能这个不会在这个做完治疗之后马上这个就出现，因为它跟我们手术不一样，手术是把身体的一些东西切除掉，它改变了我们整个人体的这个结构，所以它的一般手术的话，那个副作用是马上就会这个体现出来，但是放射性治疗的话，一般可能都是这个比较晚一些的，可能在进行这个治疗过程当中的话，有些小影响，但是不管是这个小便、尿失禁，然后或者是性功能方面的一些这个副作用的话，有可能都是之后可能12个月或者2到3年之后，然后出现的一个时间段。
So for many men, changes they may notice initially, and over time there's a decreased amount of ejaculate. So initially, yes, things may seem the same, but over time the amount of fluid ejaculated is little less. And sometimes there can be some blood in that. That happens in around about 5 to 10% of men may notice that. And anywhere from about 2%, anywhere up to 50% notice the reduced ejaculate.
然后很多的一些这个男性的话，我们的这些病人可能在做完这个放疗之后的话，可能一开始会觉得还有这个勃起的这个功能，但是有可能的话，它这个勃起的功能会随着时间慢慢的受到的一些这个影响，或者它每一次的这个射精量都会减少。然后有些在大概5%到10%的这个病人当中的话，有些时候也会这个报告说可能他们的一些这个精液或者这些液体是带血的，然后可能大概在这个2%到50%当中的一个病人的话，都有可能会出现或多或少的这个勃起功能的一个障碍。
And so for many men, also the amount of erections they get and the rigidity of those erections, so how strong those erections are, may decrease over time. And there are differences between each of the types of radiotherapy, brachytherapy and external beam as well. There's differences in how men experience those side effects. But essentially, the frequency and rigidity of their erections will change over time. And whether that's something that then causes them to have less interest in sex, so a decreased libido is talked about, in about sort of 10 to 50% of men. And desire to have sex is not there in around about sort of anywhere from 15 to 50% of men as well. And they feel sex is less important in their lives. And whether that's a consequence of the side effects or whether that's something that is happening because of the cancer side of things, it's difficult to say.
所以的话，我们这个很多男性的话，都会在这个勃起以及我们这个性高潮的这不管是次数跟强度，可能随着时间的话，都会这个受到慢慢的这个影响。然后影响的程度的话，也取决于我们的这个放射性治疗的这个强度，以及做的是哪一种，包括之前跟大家介绍过的，我们的这个是外放的，还是我们的这个体内进行的这个放射性治疗。但是基本上因为这个次数可能跟强度都减少，然后很多的一些这个部分病人的话都会说减少了他们的一个性欲，大概有10%到15%的这男性会有这个问题。另外有大概15%到50%的病人的话都会说他们的这个想要有性生活的这个欲望的话也会有所减少。所以基于这些原因的话，可能他们会觉得这个性生活对于他们的这个重要性减低了。那这个是因为它本身治疗的我们的副作用还是癌症本身的话，有些时候我们也很难去分辨。
So we talked a little bit before about hormone therapy and about the fuel for prostate cancer. Now, hormone therapy is aimed at reducing that fuel for prostate cancer. So for some men, you can see there on the side, there's a few different types of injections that you can have for prostate cancer. And aiming to reduce that testosterone, the fuel for the prostate cancer. Things like Zoladex or Lucrin or Eligard or Firmagon. If you've had prostate cancer or you have prostate cancer, you might have heard of those drugs. And they have various sort of side effects again across time.
然后接下来也跟大家这个介绍一下，之前有跟大家提过的这个激素或者荷尔蒙的这个治疗。我们刚刚也有这个跟大家介绍到，主要的话我们是因为这些激素，然后是充当一个我们的这个前列腺癌的这个能量，所以通过这个荷尔蒙治疗的话，其实就是减少我们的这个睾丸素的一个分泌。然后对于这个前列腺癌的话，也有很多不同的这些针可以打，主要的目的的话，其实就是简单的减少我们的这个睾丸素的分泌。然后这些针的话，就如果大家这个有前列腺癌或者之前有接触过，应该也了解，就包括了我们的这个 Zoladex 然后 Eligard 的这些不同的这个药物。
And so like with surgery and radiotherapy, there can be erectile dysfunction, so the loss of erections, the loss of the amount of fluid you ejaculate, if you have still have ejaculate, and that reduction in the size of the penis or the length of the penis, so it looks like it retracts. You also lose the blood vessel, the blood vessels narrow and harden, and so it then becomes much more difficult to get a natural erection or create a good erection and get a good response to some of the medications you can take as well. And as a result of that, many men report that they're less interested and they have less sexual contact with their partner.
然后其实这个治疗方案的话，跟我们之前所说到的这个手术跟放射性治疗的一些副作用的话，其实都是这个差不多、大径相同的。然后就包括可能会有勃起的这个障碍，然后可能如果是可以达到这射精的话，射精的量可能会有所减少，然后可能会发现这个生殖器官的话会这个变小一些，然后以及我们因为这个药物的原因，可能会导致我们的这个生殖器的这个血管可能会缩小或者这个变硬，使得我们可以身体自然产生的一个勃起的功能的话，进一步的去减弱。所以很多的这个病人的话，也说因为这些原因的话，他们对于这个性爱的这个兴趣是有所减少，或者和他们伴侣进行这个性生活的次数也是会有所减少的。
So you can see all of the treatments have significant side effects on men and their partners, but what can we do about it? There's and that really depends on what the goal is. So for some men that's restoring their erections, but for some people that's restoring their sex life. So not just focusing on what the having an erection, but having sexual contact with their partner or themselves, just having the pleasure of sexual activity.
然后，所以的话，这个我们刚刚说到，不管是哪一种治疗方案的话，其实都会这个造成一定的这些副作用。所以，对于这个我们的病人本身的话，或者他们的这个伴侣，其实这个影响都是挺大的。那我们有什么可以做的呢？其实我们能所做的，其实是非常取决于这个目标是什么。就是对于有一些男性来说，他们可能是想要恢复这一个勃起的这个功能，然后有一些的话，可能他并不太在意这个能否这个勃起，更多的是想要有一个这个性生活，然后不管是和他们的这个伴侣还是自己，然后去可以享受这个性爱的乐趣。
So usually what we generally start off with is we suggest to men, so if you had surgery and you want to get your function back, then what we say is we need something to open up those blood vessels, and we say we combine that with self-stimulation. So some experts in this field will say pretend you're back to being 18 again and try and masturbate as much as you can. So we say self-stimulation, whether that's daily or second daily. I say jump in the shower and stretch things out, get a bit of blood flow going to the area. You're not aiming to create a massive erection or a hard erection. You're just aiming to get some blood flow into that area to keep the tissue healthy for such time as when that nerve function recovers.
然后我们一般的话，这个是会建议，特别是这个做完手术之后，然后想要这个恢复功能的，都是尝试用一些方法，包括我们的这自我刺激，然后去使得增加这个局部的血液循环跟血流量。然后很多的一些这个专家的话，他们都会跟病人说，就是想象一下你回到这个年轻的时候，18岁，然后这个多一点的去进行这个自慰，然后跟自我刺激，然后这个不管是每一天或者这个每2天一次，在洗澡的时候，然后去这个尝试一下。我们并不是要追求说有一个这个射精，或者要让它这个勃起，更多的一个目的是希望我们可以刺激一下这个局部，然后使得它有一个比较健康的血液供应，然后跟血循环，然后保持那些这个肌肉跟组织在一个健康的这个状况，然后一直到我们的这个神经恢复为止。
And so for usually another first line option is oral medication, so tablets. And there's around about 4 different tablets in this area, and they're effectively trying to act as that switch which will open up the blood vessels to create blood flow into the area to create an erection. And so we say combine that with self-stimulation or masturbation. So some of these tablets you might have heard of: Viagra, Cialis, Spedra, Levitra, and so they're all slightly different, work in slightly similar ways but have different onsets of action. Some work within 15 minutes, some work within an hour, some are continuously working in the background, and obviously sometimes what we say is these tablets won't work initially, so you may not get a response the first time. You need to try something at least 8 times before saying, no, this is not working for me. And quite often what I say to my patients is, you're coming back to see your doctor with a PSA test every 3 months. That's when you have the discussion about how this is working, and equally with your GP as well. So they can add in a medication or change a medication, and it may be that point in time when you try that medication, you just don't have the nerve function there to open up the blood vessels, or those nerves are not there, so this may not work for you. So re-challenging your system at different times with different drugs can sometimes help. It's really how far you want to take it and what you want to do with it. It's about that discussion with whoever that person is who you're treating, who's treating you.
所以我们的话，这个也有一些这个口服的一些药物，然后基本上的话，我们在这边有4种不同的这个药物，然后它们的一个功用的话，其实都是这个通过药物，然后去打开我们的这个痉挛以及那些部位的这个血管，然后来增加水流量，然后去进行这个达到勃起这么的一个过程。然后，所以我们一般的话是会建议这个口服药跟自我刺激或者自慰，然后双管齐下，然后去采取这些方法来试一下。然后这些药物可能大家也有听过，都是一些壮阳的，然后包括伟哥，然后犀利士等等的。他们这个最终的这个效果其实都差不多，只是有一些的话可能就是比较快一点，15分钟有效；有一些是要1个小时，有一些的话可能是稍微比较长期一点的。但是很多的这些药物的话，大家需要注意，就是它可能一开始吃的时候的话，不会马上有效，你一般可能是需要有一些耐心，然后给他一点时间，多试几次，然后可能最起码吃个8、9次，然后再这个决定说，哦，这个药物可能对我没用。我们一般这个我都会跟我的病人说，因为在这个治疗之后的话，一般需要每3个月回去见一下专科医生，看看我们的这个血液报告 PSA 这个前列腺指数是怎么样。那个时候就是一个挺好的一个机会，可以跟医生这个讨论一下这方面的问题。同时的话，也可以跟我们的这个家庭医生说，他有可能可以这个给您开一些药物，或者换一下这个剂量，然后看看这个能不能达到这个效果。然后，所以有些时候你一开始的话，这个会觉得就算吃了药，但是因为我们的这些神经受到了影响，它可能还是没有办法能达到勃起的这一个功能。所以大家的话是需要有慢慢的这个耐心，然后通过药物，然后到最终的话才能够这个看看是否有效果的。然后怎么去做的话，那也是需要每个人因人而异，然后可以多多的去跟这个医生们，然后去聊聊看，就是到底这个术后或者治疗之后，你的目的是什么？你想要恢复成什么样？你想要做什么？你想要达到什么样的程度？然后根据这个不同的目标的话，我们的这些相关的这个康复方面的这个治疗的话，也会有所不同的。
So for many men, or for some men, the tablets don't work. And so we need another option. For some men, they may have side effects from the tablets and don't like those, or don't like taking tablets. For some men, they may have tried the medications, the tablets before and not had a response to it, so they may be keen to move on to the next step. And as I said, it's really about how far you want to take it. And so another good option, or another option, is injections, and injections directly into the penile tissue. And that's the one thing that men, when I counsel them going ahead with radical treatment, that they don't want to think about at that stage. But it is it can be a good option for men, and it can work for men. And it works because we're giving the medication directly into the penile tissue. So the medication goes in, the penis is essentially like a sponge. We inject the medication in, it opens up the blood vessels and create an erection, sometimes within about 15-20 minutes, and that erection can last for an hour or so. So it is another option, and there's not just one type, there are multiple medications that can be added into the mix of the injection. So if something again doesn't work for you the first time, you can try it again multiple times, but you can also try go back to your doctor and they can suggest more adding in more medications to that mix.
还有的话，这个药物本身有些时候可能没有用，或者它有一些副作用，可能病人本身他不愿意吃药，然后或者之前试过没有什么效果，那可能可以采取一些其他的这个办法。当然，这个还是回到那句话，取决于大家的这个目标是什么。另外一种这个康复的这个方法的话，就是使用我们的这个阴茎的一个注射，然后直接往我们的这个生殖器官的话去这个。那些我们的这个组织里面去注射这些药物，然后很多我们之前看过的那些病人的话，他们可能在做那个根管性的这个根治性的手术治疗之前的话，他们可能都不太考虑这一些，但其实站在我们的角度，都是觉得这些东西是有用的。然后我们是直接把药物打进去这个组织当中，然后我们的这个阴茎的话，其实像个海绵一样，然后这个当我们把药物打进去之后，把这些附近的血管，然后使得它们是张开，增加这个水流量的话，它就可以形成一个这个勃起的状态，然后只需要15到20分钟就会起效，然后是之后可以持续大概1个小时左右的。然后现在的话也有很多不同的药物，也不仅仅是一个，然后也是可以通过注射的方法，然后去这个进行的。所以更多的话也是不要说试过一次，然后就说不行没效果，然后就放弃，然后还是这个需要时间，然后具体也可以跟这个各位的这个医生去讨论一下。
Again, for some men, they don't like taking tablets, or tablets don't work for them, or they don't want to give themselves an injection, or the injections don't work for them. So the option is there for something called a vacuum erection device, so like a penile pump. And so what that is it's like a cylinder which you pop over the top of the penis and create a vacuum and draw blood into the penis. So you can use that for either rehabilitation or you can actually use it for sex. So if you're using it for rehabilitation instead of self-stimulation, so instead of masturbation, you can pop the vacuum pump on, draw some blood flow into the penis, open up those blood vessels, and do what would be happening to create an erection of a night time, so mimicking that action. You can also use it in conjunction with your medication. So you can take a pill, you can give an injection if that's what you're doing, and then use the vacuum pump to draw more blood into the penis to create a better erection. You can also use it solely for sex. So draw the blood flow in, you place a constriction ring, so a ring around the base of the penis to trap the blood in, because if you take the pump off, the blood will just drain straight out. So you pop a ring around the base of the penis, and then you have an erection. There are some differences to an erection with a vacuum device, and so the penis will, because there's no blood flow in and out of the penis, the penis will feel cold. It will sometimes look purple, and there may be a bit of a hinged effect to it. So instead of it standing more straight up, it may be slightly bent at your pelvis. And so it's then about what position you're going to use it in, directing it a little more.
所以有些病人的话，他们也会说可能不愿意这个吃药或者打针，或者觉得这两个没有效果。那还有一个叫做我们的这个负压的勃起的一个装置，然后其实这个的话就是套在我们的这个阳具上面，然后去这个抽取，然后造成一个真空的一个状态，然后使得这个我们的这个阴茎的话可以充血，然后去达到一个勃起的一个状况。然后这个仪器的话，我们是可以用在不管是这个康复治疗方面，或者是性生活，两者都是可以这个用的。然后如果是我们的这个康复的话，那其实就是去形成套在这个上面，然后去形成真空的情况，然后使得它充血，来模仿我们的这个人体本身自然的这种晚间会这个充血血液循环的这个过程。然后有些人的话会把它这个一起用药物或者这个注射一并来使用，如果他们是愿意或者觉得是有效果的话。然后还有的话就是可以把它当成是用作这个性生活方面，然后就是如果是性生活的话，那就也是使用这个我们的这个负压装置，然后套在我们的这个阴茎上面，然后抽血，使得我们阴茎充血之后的话，在这个阴茎底下我们会有一个环，然后阻止血液这个回流，这样子达到我们的这个勃起的话，就可以进行这个性生活以及性交。但是因为它跟我们正常的这个勃起不太一样，它并没有了这个真正的血液循环是会有血进去，有血液流出来的，所以有可能会感觉到这个比较凉一些，它的颜色看起来可能会比较是黑黑或者紫紫的，然后有可能它的这个硬度，然后没有以前那么的直，有可能会比较这个弯一点点，然后这个的话可能也是需要一些这个位置跟体位来进行配合。
And so, if all of those options don't work for you, there is a surgical option down the track. Obviously, it's generally not something which is funded in the public health system, so it is an operation which you generally may need to have it in a private hospital and be funded and pay for the device and the operation. It is in some cases done in public hospitals, but it is limited to a quota and only done in certain places. So for many men it's inaccessible, but it is an operation that can be done, and it's effectively like a hydraulic device. You've got a small pump which is in your scrotum. You press the pump, and two tubes which are inside your penis are inflated and create an erection. As with everything, it's how far you want to take it, and certainly not something you have to do, but the option is there if you firstly can afford it or are able to have it, or you want to have it basically.
然后，如果这些方法都这个没有效果或者不想要的话，还有另外一个的话，就是做这个人工的这个阴茎，然后或者是这个假体。但是就这个部分本身的话，这个它是并不包括在我们的这个公费医疗当中的，这可能就需要去这个私人医院去做，然后以及的话需要自己出钱，然后这个的话基本上其实它就是植入一个假体，然后会有一个按钮，当有需要的时候按一下按钮的话，里面就会有2个管子，然后会把这个我们的阴茎然后冲起来，然后达成这个勃起的这么一个功能。这个也不是说一定要做，但是是存在的这么一个可能性，然后也得看看大家的这个承受能力，以及大家就是到底目标是什么，想要达到什么样的一个程度。
So of course sex is not just about an erection, it's about it's about pleasure and it's about enjoying the experience. And so, you know, you think back to what you, before you, when you were courting someone, what you enjoyed doing and those sensations and feelings you had when you were about to have sex, or you know, you couldn't have sex, but you enjoyed that pleasurable experience. And so it's about exploring those feelings and those things, foreplay and masturbation and mutual masturbation, and exploring your body and each other's body. And for some people that, you know, may involve toys, vibrators, strap-on toys, and a really good resource, as terrifying as it is for some people, is an adult store, a sex store. You can access them online, but you can also go into your local adult store or sex store, and you say, I've got prostate cancer and I want some advice on what you can offer me. And quite often, you know, the people who run these stores are seen as, you know, sleazy people, but they're quite often not. And they have a really good working knowledge of what they've got that can help you along the way. And so they can be a really good resource for rebooting your sex life, for adding things in, for looking for these aids. So don't discount them. And I know it's quite often terrifying to go into one of these stores if you've never been into one before, but it's an option, and they do give some good advice.
然后其实更多的话，我们也不仅仅是这个勃起，性爱方面或者性行为，更多的讲究的是这个享乐。然后除了这个勃起功能之外的话，我们说的这些感官，我们的这些感觉，然后对于这个马上要进行这个性交的这种喜悦或者这种期待，其实都是这个包括在内的。更多的话，可以去了解以及探索一下这个自己的身体以及感觉。然后注重可能这个前戏，然后我们的这自慰或者互相自慰，然后大家相互的去了解这个身体，有需要的话可能也可以这个使用一些这个玩具，然后不管是震动式的或者捆绑式的等等。其中一个的话，这个可能也是大家觉得比较难为情的，其实就是去咨询一下，然后特别是大家可能可以不管在网上或者在我们的社区当中的一些成人店。然后我们也这个了解到，可能很多人都觉得可能他们不太正经啊，或者能开这些店的，其实都不正经人，但其实现实不然，很多时候我们都可以建议，就是去问问他们，说我有这个前列腺癌，有这些什么的情况，然后有什么是可以帮助到我的。他们很多时候的话都是非常有这方面的这个知识的，然后也可能可以这个帮助得到。帮到你，所以也不要觉得说，特别是可能之前从来都没有进去过或者去了解过这方面的信息，然后就觉得挺难为情。他们的话，其实有些时候是可以提供一些挺好的建议给你的。
And so the last point I'd make is this is not easy. Recovering sexual function can be very hard, and some men really struggle, and partners really struggle with this. And so it needs a conversation. So you need to talk to one another, you need to share, but sometimes you need to seek professional help with this as well. And so there are psychologists and there are sexologists who work in this area specifically, who can help you along the way, can talk about, you know, the functional problems, so the problems that you have had as a result of your surgery, which have then caused problems with maybe your relationship or the way you talk about sex and the way you relate to one another. And they can give you strategies to work on, you know, both the functional side but also the communication side of things. And so I do encourage people to seek this out.
所以我们也想要跟大家说的，就是这个的确也不容易。然后很多时候，不管对于病人本身，或者对于他们的这个伴侣的话，这条道路的话，其实也并不好走。所以很多时候的话，也需要大家去进行沟通，然后去互相的了解，然后这些情况，甚至有些时候的话，可以去寻求专业的这些意见跟帮助。我们有心理医生，我们有性学的专家，然后可以不仅仅在因为可能手术之后或者治疗之后所造成的一些功能性的影响，然后去给出一些建议。很多时候可能因为这方面所影响到的关系，然后可能跟伴侣的一个亲密度啊、关系等等的话，他们可能都可以提供一些方法来改善，不仅仅是功能性方面的问题，以及沟通性的方面的问题。所以我们还是建议的话，有需要可以寻求他们的帮忙。
So quite often that conversation is about where you want to go and what you want to achieve. So what's your goal? Is it penetrative sex? Is it I just want to orgasm? Do I just want to masturbate? Or I just want to be intimate with my partner? I want sexual connection. I want contact. Or I just want I don't want sexual contact. I just want contact, or I just want to be intimate in a non-physical way. It's about the benefits. So what are the benefits? So we're less stressed, and we adjust to the difficulties of cancer if we have a good sex life or good sex function. So there are benefits to maintaining and working on this. You feel better about life quite often. Now, it's not the be all and end all for everybody, but it can be an important part of adjusting to cancer and living a happy life.
然后，所以的话，更多于取决于的就是大家的一个目标是什么？是想要进行房事，或者真的去进行性交，还是达到高潮，还是说自慰，还是说我仅仅是要和我的伴侣保持亲密度，然后保持这种连结，还是说我是不想要性连结的，然后不想要有任何身体上的一个接触，主要都是得看每个人的情况跟目标是什么。然后，但是保持一个良好的性生活的话，是会对我们有挺多的好处的。第一个的话，可以减少我们的一个压力以及负面的一些情绪。当我们有一个比较良好的性功能或者性生活的时候的话，它对于我们整体的幸福感会有帮助，也可以帮助我们的话更加好的去面对以及适应我们的癌症。
So quite often what many people miss is that intimacy. It's that togetherness. So how do you get that back? So it's about small things. For men, it's our sexual desire and our sexual function is often quite instant. As I said, we see things, we want something, and it's on. For women, that's not the case. It's a slow burning fire. So we need to work on that connection. We need to do things together, whether that's reading a book to one another or reading together, watching a movie together, holding hands, walking together, touching. All of those things are about rebuilding that connection, talking to one another, making time for one another to do those things that you enjoy or that you don't get time to do because of what's happening in your life outside. So it's about reigniting that connection, and then it's about reframing what sex is from there on.
所以其实我们更多看一下我们的和伴侣当中的一个亲密性，或者我们的一个亲密度。 然后很多时候的话也得两者一起去看。很多可能男性的话，我们之前也有说到，可能我们看到或者想到些什么东西的话，这个相关的性欲望，然后就会被这个勾起，然后是比较自发性的。对于女性来说的话，可能她们是比较慢热一些，所以可能互相的话，大家有这个连接的话，要有亲密性，可能也可以很多时候做一些这个一起做的一些事情，包括这个大家看看书，然后看看电影，然后拉拉手，然后说说话，然后特别是如果没有时间的话，然后去安排时间去做这些事情，然后来达到一个良好的关系，以及保持我们的这种联系跟连接。然后更多的也得大家去重新思考一下，我们的这个性对于我们来说是什么。
So just lastly, just some tips for recovering that sexual function and that sex life. Define your goal. Is it penetrative sex? Is it masturbation? Is it pleasure? Is it intimacy? What's your goal?
那最后的话，也给大家一些这个相关的康复方面的一些建议。第一个的话，其实就是设定一个目标。您的目标是什么？你是想要这个进行性交？你是想要这个勃起？是想要可以达到这个高潮？然后还是说是要保持跟这个伴侣的一个亲密度
？Manage your fear and anxiety and talk. So talk to your partner, talk with a nurse, talk with your doctor. Tell them what your frustrations are, tell them what you're worried about, and tell them where you want to go with that. The old adage, a problem shared is a problem halved. So putting it out there is often the first step to managing that fear and anxiety about, is my partner going to reject me because I can't do this? Well, no, they're not. They're with you because they want that connection. So it's about talking about those things and getting their feeling about those.
所以的话也得去管理，然后控制一下我们的这个恐惧以及焦虑，更多的去这个交谈，包括跟我们的伴侣、跟我们护士、医生等等的，你的担心是什么？你的这个问题是什么？我们之前也一直说到，对吧？当我们找到问题的时候，问题就解决一半了。然后当我们直视跟面对这些问题跟恐惧的时候的话，都对于解决他们的话，这个是有帮助的。就比如说跟我们的一个伴侣聊天说，对吧？他们会不会因为我现在没有办法做一些什么东西而拒绝我或者怎么样？但是可能通过交谈之后，你会发现他们其实并不会的。他们是我们的这个伴侣，然后他们其实也想支持我们，但是很多的这些心里面的一些想法的话，都需要通过交谈才能够了解得到的。
And the next two go hand in hand. So exploring your body and finding out what feels good. So take the time to be aware, to be self-aware of, what makes you feel good. Whether that's physical touch, or whether it's how you're touched or where you're touched. And the sensations that go around that, how long it takes you to get those sensations. So be aware of those things. Explore your body and find out how long it takes for those things to happen, and what you can do to enjoy pleasure with yourself, your partner, or whoever else.
然后接下来两个建议的话，其实相辅相成的。然后第一个，探索您的身体，然后看看有什么是可以让您感觉比较好一些的。所以这个的话，需要去自己去这个摸索一下，然后去了解自己的身体到底是怎么样的。是比如说通过一些什么刺激，然后或者是一些触碰的感觉，触碰哪里，怎么样去触碰，怎么样的一些行为会这个导致一些刺激，然后会有感觉，然后多长才会使得这些反应，然后当你了解了这些之后的话，然后把它记下来，那么下一次的之后的话，就可以不管是自己还是跟伴侣的话，然后去享乐。
And the next thing is the same sort of thing. So play. So don't be limited to what what sex was before. So try and explore different options out there and mix things up. But make a choice to engage in activity. So you may not be immediately interested, but it takes a little time to get there. So give yourself time and make a choice to regain that sex life or regain that function in some form if that's what you want.
还有的话就是可以去这个玩，或者我们更多的是去尝试一下，可能不一定说要恢复到跟之前这个一模一样，去尝试一下一些这个不同的东西，然后去这个参与当其中，然后这个给自己更多的一点的这个时间，然后使得自己可以慢慢的恢复这个性功能或者这个性生活，如果这是你的目标的话。
And the last two are look after yourself. So take care of yourself physically. Do all the things that you need to do to live a healthy life. So eat well, exercise, look after those sides of things, the physical side of things. But be kind to yourself. Be patient. This is not easy. It takes time and it takes patience to get back to where you want to be. And it takes some adjustment, and it's not a straight path for many people. So be kind to yourself. Enjoy the small wins. So enjoy finding some pleasure in something and then building on it. That was good this time. Maybe we can do this next time, or maybe I can do something else. Be kind to yourself. Be patient.
最后2点的话，就是也是希望大家可以这个善待自己，然后好好的去照顾自己，特别是自己本身的这个健康，然后吃好睡好，然后这个做运动，然后更为重要的是需要去这个善待自己，然后给自己更多的时间跟耐心，因为整个的这个过程的话，这个并不容易，康复的话也需要大量的时间跟这个耐心的，然后可能也会有很多东西跟之前不一样，然后也没有一个简单的这个万能药就可以解决所有的问题。大家也可以更多的专注于我们这个生活当中的一些小确幸，比如说这一次有发现了一个，感觉这样子挺不错的，那下次的话也可以考虑看看。更为重要的话，希望大家记住的就是需要善待自己，照顾好自己。
Sorry for taking up so much of your time, but thank you for the opportunity. I just want to say where you can get help. So your GP, your urologist, prostate cancer nurses or urology nurses in general. There are sexologists out there, so there is a sexology society for people who specialise in this area, but also psychologists. The Prostate Cancer Foundation and Men's Line as well are very good at the counselling side of things. Again, thank you for your time. I'm sorry to take up so much of it, but it's been a pleasure to share this with you. Thank you.
然后最后的话，也非常谢谢大家的这个时间和大家的这个参与。最后想跟大家说一下，就如果有需要的话，可以去找我们的这个家庭医生、我们的这个专科护士，然后性学家、心理学家等等的这些专科的医护人员，然后去帮忙。然后我们的这个幻灯片当中的话，也有一些网址，然后如果大家有兴趣的话，也可以去这个浏览一下。最后的话，再一次的谢谢大家，然后非常感谢今天有这个荣幸，然后可以跟大家分享这个主题。And we have these Q&A sections, questions. 然后我们接下来的话就是会有一个这个问答的一个环节，然后我们有一些这个观众的问题，我们问一下我们的这个 Benny 先生。这个问题的话，我们先 I'm gonna read it in Mandarin first.
Okay. Yes.
Yes. 然后有一个我们第一个问题是说这些这个性功能康复治疗的这个用药，然后有什么副作用，然后与治疗癌症的这个药物这个放化疗是否有这个冲突？ So the first question is that previously in your PPT we mentioned that there's some medication, oral medication that can help in the rehab, like the Viagra that we mentioned. And the question is that are there any side effects of this medication? And if I take this medication, at the same time with the cancer treatment, let's say medication or chemo radiotherapy, are there any impacts or influence on that?
Yeah. So yes, there are side effects of medications. And particularly the oral medications, and not everybody, obviously with all tablets, not everybody gets those side effects. So quite often the common side effects of Viagra, Cialis, and those oral tablets can be facial flushing, headaches. Some people get muscular aches and pains. A very small percentage of people will get blue vision from Viagra, and that's something that if you take it, you don't take the tablet again. There's some of the main side effects, I think, of tablets. Now, can you take those with other treatments? Yes, you can, but you need to talk to whoever your treating doctor is at the time. So in terms of radiotherapy, yes, you can take it with radiotherapy. Yes, you can take it with hormone therapy. You can take it with chemotherapy, but you certainly need to have a discussion with whoever the treating doctor is at the time about what medications you're taking and around about the timing of those medications.
那药物的话是这个肯定会有一些的这个副作用的，包括我们之前跟大家介绍的这些这个口服药。当然这些副作用的话也会因人而异，并不是说每个人这个都会出现。但是一些比较常见的副作用的话，就包括会潮热，就是脸的话比较红，或者我们的这个会头痛，然后会有一些肌肉痛。然后我们之前说的那个伟哥的话，如果吃了有一些比较罕见的情况下的话，可能的他看东西的话会比较有一些比较蓝一些，如果这种情况的话，我们一般就是建议这个不要再吃。然后能不能这个跟一些治疗癌症的一些其他的药物或者放化疗一起使用的话，其实是可以的。当然的话是必须要让您的这个主治医生知道。然后不管是这个放疗、这个放射性治疗、化疗还是荷尔蒙治疗的话，都可以去使用这些这个帮助康复性功能的这些治疗药物，但是得跟这个医生说，然后看看这些药量啊，然后吃的时候等等怎么样，然后就跟主治医生再去商量。OK， 然后第二个问题，然后说这个阳痿治疗会增加前列腺癌扩散的可能性吗？ So the next question is regarding incontinence treatment. So treatment for this incontinence, will those treatment increase the likelihood or the possibility of the prostate cancer being spread or metastasized?
No. Treatment for incontinence involves first-line therapy is pelvic floor exercises, so learning exercises to support the bladder and stop the flow of urine out. So that's first line, and then the next options in terms of incontinence is quite often different types of operations. And unless the cancer is already spread beyond the prostate, there's very little chance of it spreading as a result of that operation. And obviously that's a discussion you have with your doctor at the time in terms of where your cancer is at. But generally there's no absolutes, but there's also no lost my train of thought. There's no contraindications, so there's no reason why a person who has metastatic cancer can't have treatment for incontinence with surgery unless the immediate area is affected.
对于这个的话，其实是不太会增加这个扩散的这个可能性的。如果我们是有这个失禁的情况的话，有很多不同的治疗方案。一般的话，第一个是通过我们的这个盘底肌的一个运动，然后有些时候的话比较严重，可以考虑这个手术，然后来这个解决这个问题。但是并没有这个具体的这个说到这个会影响到它的这个扩散，或者扩散的癌症的话是不可以接受这些这个尿失禁的一个治疗的。 And the next question， 下一个问题，前列腺切除手术之后，性高潮时，这个输精管不能输出精液到体外，那么精液去了哪里？如果依旧留在体内的话，会产生这个健康问题吗？ So this question is regarding after having the prostate gland removed. So once I have the prostate gland removed and I have the orgasm, the sperms cannot be due to the lack of the tube. It cannot be ejaculated outside of the body. So where do they go? And if they remain inside the body, will that somehow affect the body or the health of one's?
No, so the production of sperm becomes less so over time. And so the testes produce less, and some men, if they haven't previously had a vasectomy, they experience a little bit of testicular discomfort over the first few months as it becomes a little bit engorged or enlarged while that accumulation still happens. But gradually over time, less is produced, and because it goes nowhere, nothing happens.
然后它这个的话，其实就是这个没有对于健康的话没有太大的这个影响的。这身体自己本身的话，它随着时间所分泌的这个精液的话，会慢慢的变得这个少。然后一开始的话，刚做完手术之后，因为这个做了这个输精管切除已经拿掉了，所以一开始这个睾丸的话，有点可能会感觉到不舒服或者胀胀的，因为身体还没有这个适应，然后一些分泌出来的这个精液的话就会储存在那边，但是身体的话慢慢就会适应之后，所分泌的精液就会越来越少。那它们只是保留在体内，所以它们对于这个身体的话也不会造成什么样健康方面的影响的。下一个问题 ，Next question， 前列腺癌切除后对性交有心无力，因为阳具不坚硬。怎么样对和异性这个交合 ？Okay, so the next question is about same after having the prostate gland removal surgery. I have a desire to have sexual intercourse, but I'm unable to do it, partly because the penis is not hard enough. And how should I have intercourse with my partner in this situation?
Yeah, so it's as we talked about, there's lots of options. So it depends on what you want to define sex as. So if we're defining it as penetration, then the options are trying tablets, combining that possibly with a vacuum device to strengthen that erection, and then popping a ring around the base of the penis to trap that blood flow in there. That's an option. The other option are the injections directly into the penis, and again you can combine that with the vacuum device. So they're the main options to start off with, and then I guess we talked about those other options a little bit before.
所以这个的话也得这个看看到底还是目标或者想要做到的是什么，然后包括我们刚刚在幻灯片也有跟大家这个介绍，然后如果是想要达到这个真正的这个交合性交的话，那么我们可以采取这个口服的一些药物，然后再加上我们的这个负压的这个勃起装置，然后在这个阳具的这个底下，然后再放一个这个环，然后来保留住这些这个血液，来维持这个勃起，那这些都是可能可以做的。然后还有的话就是用我们刚刚跟大家介绍到的这个注射，然后这些的话都是可以去考虑的。Okay, and second question， 然后还有一个问题 ，PSA 手术8个月之后 ，PSA 数都超过0.2，现在已经到0.8。每3个月目前要抽血 PSA 看报告，这种情况常见吗？你有什么看法或者经验可以分享吗？ So this gentleman had a surgery, and after 8 months after the surgery, and then the PSA is 0.2, now is 0.8. and having the PSA blood checked every 3 months, as you said. And the question is whether this is common, and do you have any suggestion or experience that you can share?
So yes, PSA can change over time, and really it's about the nature of what your cancer was when it was removed, how close the cancer was to the edge of what's been cut away, and the nature of the cancer, whether that was a lower grade cancer or a low intermediate grade cancer or a high grade cancer, as to how that PSA may respond over time. So we know that even if we do the best scan we have on the day of the operation, we can't account for microscopic cells outside the prostate on that scan. So PSA, by taking out the prostate, we assume that the PSA would fall to undetectable because it's a source of the prostate. But sometimes PSA doesn't fall back to undetectable, and we get this little bit of a trickle. So 0.01, 0.02, 0.08, and sometimes it goes up and down like a wave for a long time and never goes up. But for some men, yes, it does go up, and it's about watching that PSA and the trajectory of the PSA, and making a decision based on that as to whether further treatment is needed.
Oh. 这个的话，其实要取决于看看他的这个手术是怎么样的，然后做的是一个什么样的手术，以及他手术的程度，也得看这个前列腺癌本身，它是属于一种这个低度、中度还是高度恶性的这个癌症。然后目前的话，这个就算我们做很多的这些精密的这个扫描，在手术过程当中的话，也没有办法把所有的这些可能这个癌细胞都能够找出来，然后去这个进行切除。在手术的时候，我们把前列腺切除之后，我们希望是可以达到比较理想的效果，就是 PSA 之后验血是验不到的，但是很多的情况可能都是会能够检测到一点点，不会很高，0.2、0.3、0.8等等。然后它随着时间的话，会这个时高时低的，像个波浪一样。然后这个更为重要的就是看着这个定期的去检查，然后看一看它的这个趋势是怎么样的。如果是这个变高的话，那可能就需要跟这个医生商量一下，然后去考虑看看需不需要进一步的这个治疗。Okay, and last question， 我们最后一个问题是：既然男性荷尔蒙不利前列腺癌细胞，那么性生活会否导致或者刺激男性荷尔蒙而引致前列腺癌复发？So last question, very interesting one. We talked about, or you talked about that the testosterone or the male hormone act as a fuel to the prostate cancer, and by having sex, would that actually stimulate the secretion or the production of the male hormone that may trigger or increase the likelihood of the prostate cancer relapsing?
It's not going to be the contributing factor. It's really about the prostate cancer cells, wherever they are, producing their own PSA and creating a response that way. It's unlikely that sex is going to increase the likelihood of cancer recurrence if those cells are there. It's about the nature of what's happening in that cell more than the amount of testosterone being produced as a result of having sex.
这个的话，其实简单来说就是并不会这个导致或者引致这个前列腺这个复发的。这个前列腺这个它之后的一个发展或者是否复发的话，得取决于它们的这个细胞本身它的一个这个位置，跟我们这个有性生活，然后刺激这个男性荷尔蒙的话，然后导致这个癌症复发的这个概率的话，其实是很低的。之后的癌症的一个发展，取决更多的是癌症本身，而并不是因为这个性生活而引发或者刺激的这个男性荷尔蒙的一个分泌。
Thank you. Great questions.
so much, Bernie. Thanks for all the presentation.
Not necessary.
Oh, no, just a small
Oh,
gift.
thank
Sorry,
you.
sorry. Oh, sorry. Take a photo.
Yes, definitely.
Thank you
Thank
very
you.
much.
Oh, thank you, Emily.
I just
Thanks for
say
the
a few
opportunity.
words
Yeah,
to
thank you.
them 哈。那我们非常感谢哈，非常感谢今天 Bernie 呢跟我们有做了一个很詳細的介紹哈，希望呢對大家也都能有幫助嚇。多謝咧 Bernie 咧今日同我哋都係講得好詳細嚇，咁希望咧對大家有幫助嚇。咁大家記得咧，我哋咧係仲有一個嘅線上，即係用 Zoom meeting 嘅支持小組嘅，就喺而家結束之後10分鐘之後咧，我哋就會開始㗎啦。咁請你咧10分鐘之後咧，你就可以通過我之前俾你哋一啲嘅連結啦嚇。通過呢個 Zoom meeting 咧係入嚟啦，咁我哋會有個支持嘅小組嚇，我哋會分享一下咧成個經驗啊，同埋咧係分享一下咧你嘅一啲治療啊咁嚇。記得報了名參加我們的支持小組的朋友呢嚇，在10分鐘，我們這邊結束10分鐘之後呢，請你登錄通過 Zoom 我給過你的鏈接，登錄到我們這個系統裡面哈，然後我們會有支持小組跟你討論一下你的一些看法啊，或者你還有一些什麼問題，跟其他的病人呢能夠交流一下，好嗎哈？那好了，除了這個之外呢，我想再跟大家說一下呢，之後我會給大家發一個連接，這個連接呢會是我們的有一個簡單的意見表，是線上的，希望你們花2-3分鐘時間給我們一些意見哈，方便我們的改善以後的這個服務嚇。咁喺今日嘅活動之後咧嚇，我哋會俾你哋發一個through text message 啦，可能聽日先至發㗎啦嚇。咁咧就係會有一個連接，係有一個意見表嘅嚇，希望你咧花2-3分鐘時間咧幫我哋填一填呢個意見表嚇，等我哋可以改善咧日後一個嘅服務嘅嚇。仲有咧，我哋喺下個星期一開始啦，我哋係有1連5次嘅呢個叫康復保健課程嚇，下個星期一嘅朝頭早嚇，1連5次。咁我哋咧就會係呢個康復保健課程咧係用廣東話進行嘅嚇，會係有一個嘅運動治療師啦，同埋咧係一個營養師咧嚟到我哋當中嚇，特別係針對咧係你已經完成你嘅治療2年內嘅病人嚇。咁我哋仲有1個位嘅啫。咁如果你有興趣嘅話咧，請你咧係盡快打電話嚟更新會啦，0292127789咧係同我哋報名嚇。記得咧呢一個康復保健課程咧，你係需要咧係親身嚟到更新會，即係我哋喺Haymarket呢個嘅地址嗰度咧係參與嘅，因為我哋有好多運動啊等等咧要介紹俾你，咁你要當場要去示範，即係要去做啊咁樣嘅嚇。另外呢，最後呢是我們還有一個康復保健課程，還有1個位置，從下個禮拜1開始1連5次，是針對呢是已經完成治療2年內新的癌症病人，好嗎？哈，這個課程是以廣東話進行，所以如果你能聽得懂廣東話的話呢，也歡迎你來報名，但是要盡快啦，是打電話0292127789嚇。咁今日我哋嘅時間咧係到呢度嘅嚇，咁好多謝大家咧係嚟到係收睇我哋今日嗰個嘅講座嚇，咁下次再見啦嚇，多謝10分鐘之後見下，有啲朋友10分鐘之後網上見。Thank you so much, Bernie.
Pleasure.